Valley Immediate Care, we've already seen an impact of the Affordable Care Act. Obviously, with more people who have insurance, there's going to be more people that are not waiting on those aches and pains and colds and sore throats and are seeing us much more rapidly. The problem we see in the future going forward is that both state and federal healthcare initiatives have been aimed at health insurance, and the assumption has been made that the lack of health insurance has been the big barrier to receiving health care in the state and the country. And a piece of that is very true. However, once you provide the general population with health insurance, then we face another structure, and that's the number of docs available. In many areas of the country, the shortage is acute, and that includes Southern Oregon. Looking at Massachusetts as maybe a predictor of what we're going to be facing, Massachusetts is arguably ahead of us in this grand experiment that we're undergoing. The wait to see primary care in Massachusetts has almost tripled over the last couple of years since the advent of Romney Care, which is their version of Obamacare. And we expect that was probably going to be worse in Southern Oregon. Southern Oregon has two problems that are going to make it much more complex and much more acute. Number one, we have a huge Medicare population here. It's a great retirement area. Our Medicare population is really, really large and growing all the time. The second piece to that's interconnected is that Southern Oregon has one of the lowest Medicare reimbursements in the United States. And so the high Medicare population, coupled with the low reimbursement for Medicare patients, is making it increasingly difficult to attract physicians to Southern Oregon. It's a great place to live. The quality of life's wonderful, but physicians, you know, they come out of school and they've got hundreds of thousands of dollars of loans, and they've got a young family, and they like to buy a house and pay off those loans, and they're bypassing Southern Oregon. They just can't afford to come here financially. So with those issues in mind, we have to, our system has to provide some alternatives for patients that have episodic need for care, for illness or injury. If primary care is going to take you 4 to 6 or 8 weeks to get an appointment for that sore throat, sprained ankle, possible broken finger, cut on the knee, all those types of things are not going to wait for a primary care appointment. And so we have to provide urgent care or intermediate care or fast track, as the hospitals call it, to accommodate those needs. If we do not do this, then all those episodic illnesses or injuries will end up in the emergency room, and that's going to bankrupt the system. So we have to provide an outlet, a ready access for those episodic needs. In many areas of the world that are arguably ahead of us in this experiment, that have a single payer, a quasi single payer healthcare system, access is very, very strained. You look at Canada, the UK, Norway, Sweden, they have a nationally sponsored healthcare program which is free for everybody, which is great. But the problem is access. A friend of mine who's an X-ray tech that lives in UK recently came back from a visit to see her mother, and her mother had a sore hip. So she waited several weeks to see her primary care doctor and says, you know what, you need an X-ray. I'm going to schedule that. Another couple weeks went by, she got the X-ray. Then she had to wait for another 2 weeks to see her primary care physician again, who looked at the report and says, you need to go see an orthopedic surgeon. That was scheduled several months out. So this saga is still going on right now for a simple hip problem. So again, that's what we're afraid that's going to happen in this scenario. And so we have to provide some ready and available access to health care. And we see urgent care as a big piece of that.